and cultural context of psychedelics. Most of us are coming to this from whatever perspective we bring, whether it's palliative care or psychosocial oncology or psychiatry. But it's important for us to realize, as much as this is maybe a new phenomenon for us in Western clinical medicine, this is an ancient phenomena for many cultures. So I want to talk a little bit about history and culture. Knowing the experts in the room, I'm going to stay away from too much specifics on history or neurobiology and keep it very general. But thank you so much for your interest. I really do feel like this is a living community of practice, and it's a community of inquiry. We're all figuring this out as we go, and we have a commitment to honoring the evidence and listening to the amazing patient perspectives. But we all bring our own lens to this, and part of what we bring is the lens of our culture, our dominant culture, our subcultures, whatever other cultures we belong to. So I think it's important, much like when we look at cell culture or those people who grow mushrooms, cultures are very important. Obviously, it's the conditions to maintain growth in life. So we want to look at what kind of supports this work, where it's come from, and what we might decide to do together. So some learning objectives, just to understand, at least on a very broad stroke, the historical and cultural context for modern interest in clinical trials around psychedelics. I want to identify and honor the living indigenous histories of plant medicine use. Often we think of these histories, or they get described as if they're in the past. They continue to evolve. They are vibrant. They are alive. We'll talk a little bit about some of the things going on in that space, but also to understand the importance of culture, practice, and belief in shaping total drug effect. And that isn't just the expectations or the belief structure of the patients, but it's your belief structure. It's what you're bringing into this. As you know, we all carry a lens, and it's important. We all have a lens, there's no judgment on that, but being aware of the lenses gives us an added degree of sensitivity and intelligence. And we know that belief and expectation have an enormous role to play in psychedelic-assisted therapy. And also to understand how culture introduces implicit bias and beliefs to our scientific and clinical work. So just by way of declaration of conflict of interest, I do consulting for private companies, both in psychedelics, psychedelic retreat centers, medical cannabis. You know, from a standard conflict of interest, the research findings I'm presented could be of financial interest to me. Just to declare that, I'm definitely not alone there. But also just my own experiences have undoubtedly influenced my own perspective. I kind of came of age very rapidly at the age of 20 when I got hired to help start a needle exchange program in Kingston. So I was thrown into the underground world of heroin use and opioid use, methamphetamine use, at a very young age, and not with any background to understand it other than half of a philosophy degree, which apparently got me far enough in the door that I learned some valuable life lessons, including the first elder teacher I ever had who introduced me to this work said, Ron, you know, I think one thing you need to remember, two things, which is shut up and smoke cigarettes and drink coffee with people. So that began an unfortunate lifelong interaction with tobacco, caffeine dependence, but also an ability to kind of sit and listen. So I have worn many hats in the psychedelic space. I have been an investigator in clinical trials. I'm obviously a co-investigator here. I've been a clinical trial therapist in our alcohol use disorder plus motivational enhancement therapy under principal investigator Dr. Suarez. That was a remarkable experience. I have been a participant in entheogenic rituals, which I will call my field work, for more than 10 years. And for about 7 or 8 years, I practiced as an underground psilocybin practitioner. So I'm going to bring all those lenses to kind of what we're talking about here. I know some of you know who this is. Anybody want to kind of name this moment in time or who this is? Gordon Wasson. Which one's Gordon Wasson? And Maria Sabina. So I was born in 1969, just to really give away my age. And I was very much a child of the 60s, grew up in the 70s. I grew up knowing who Maria Sabina was from countercultural posters, the work of the McKenna brothers in teaching people how to grow psilocybe mushrooms throughout North America for the 1970s. I read Carlos Castaneda at a young age, discovered Alan Watts, then Buddhism at the age of 16. But I grew up knowing who Maria Sabina was, at least in a cultural reference point. I will say, from understanding the history of colonialism, this is a problematic moment, but it's also the moment that probably let loose the understanding. The article in Time Life magazine that this was published in 1957 was called Finding the Magic Mushroom. That's where the term was coined. Maria Sabina, for those of you who don't know, was a curandero, a medicine woman, knowledge keeper, elder of a Mazatec community who was discovered by Gordon Wasson, who was a banker, but also an amateur mycologist. I don't know if we can call him amateur. He wrote some fairly massive tomes along with his wife, Valentina. So they were mushroom mycologists, and there had been indications or rumors of a kind of sacred mushroom that ethnobotanists and ethnobiologists had been seeking for really probably by then 70, 80 years. I'll talk a bit about that. But Wasson in the 1950s got rumor of a woman named Maria Sabina who was doing mushroom ceremonies with people. So he managed to find her, introduce himself, explain to her what he was doing. I don't think we can look at it now as any form of real informed consent. I don't think she would have consented to everything that happened. She and her community ended up paying some significant kind of negative consequences due to the world attention that came soon after this, but it's also probably the reason we're all here. So with great gratitude to Sabina for sharing the generational knowledge. As we know, we have evidence of thousands of years of both sacred mushroom use in Mesoamerica, but also peyote use, wachuma, San Pedro, ayahuasca. These are ancient, we know that. These are the original plant medicines that those of us in the psychedelic space owe a debt of gratitude to. But this is the moment, both beautiful and problematic, which introduces this theme of two-eyed seeing that I want to kind of introduce today, which is being able to understand and appreciate the entheogenic histories of indigenous peoples, but also understand the medical, clinical, scientific lineage that we carry in Western scientific culture as well. We all have a lineage and history we carry. So this was Seeking the Magic Mushroom. This was from the Time Life magazine, 1957. So obviously after this, you had a massive outbreak of interest. This is where Leary and Richard Alpert get interested. Obviously, Alpert goes on to become Ram Dass. People are familiar with his history. These were Harvard psychiatry professors who I think are to this day the only tenured Harvard professors to be fired. Is this correct? I believe, Erica? I think so. So, and that's largely because of their attitude, very promiscuous attitude towards distribution of psilocybin, mostly to undergraduates, which was indeed problematic. So that introduced, but again, that movement, the hippie culture, as much as we kind of look back with some fondness, the approach to psychedelics there was it was countercultural. It was anti-system. It was understanding the need for cultural change. And at that point, you had deep conservatism. You had fighting still for rights of racial minorities and women, and the lesbian gay movement hadn't even come in yet. So this really is the hotbed for the social change liberation movements that came through the 60s and 70s through the hippie movement. But we know that psychedelics have been a part of that. I would look at it, study in contrast when we look at the modern culture of psychedelics. We're talking about therapy. In the 60s, it was social change and liberation. And I think for me, that's just an interesting study in history. But it's important that we acknowledge the indigenous histories. And this is simply a quote from the declaration, from the second declaration by the Indigenous Medicine Conservation Fund delegation to the psychedelic field. This was from 2025 earlier at the big psychedelic science conference in Denver, I believe. Was anybody there? People were there? Did you see this presented? I know they went on stage and presented, I think, at some point. Yeah.
Videos are available.
Oh, perfect. Awesome. Worth listening to, worth reading. The one quote I pulled out was, "Our medicines and practices belong to cosmologies. Extracting them from their original context has great consequences." So I think this is an important question because obviously when we're dealing with psychedelics, they occasion states, non-ordinary states of consciousness, which we're not really well prepared for in our society. We're often told there are incidences of psychosis or there are lesser forms of knowing. So for us to kind of parachute in a way into understanding the cosmology of, say, a community that would have used magic mushrooms in Mesoamerica, it's a totally different context for it. Our belief structure is different. We may be interacting with the same mushroom, but our belief structures are different and our approaches are different. But I would argue that the shape and form of everything, the importance of ritual, of practice, and of interaction around areas of unknowing are common to both. So this is Richard Evans Schultes, Harvard ethnobotanist. I love the work and writing of Schultes. I believe here he's doing Varroa snuff, probably, most likely, doing Varroa snuff. So he was an ethnobotanist who studied and understood the relationship of plant medicines and culture. So unlike with us in a Western framework, you may look and say, okay, this is serotonergic, there's certain kind of cellular apparatus it's activating, here's the biology of it. In this context, they're looking at interactions with the natural world and interactions with both plants, but also the notion of plant spirits or the cosmologies where plants would introduce you to certain forms of intelligence certain forms of knowing. And so he had a particular interest in DMT-containing plants, including ayahuasca, but also the search for the sacred mushroom, which in the Aztec kind of codexes was referenced as something called Tioninacatl, flesh of the gods, kind of more recently translated as the mushroom that paints. So this is all through the kind of 20s, 30s, 40s, and 50s. There's this gradual evolution, really, that goes back to the late 19th century of cultural anthropologists and ethnobotanists searching for these kind of psychedelic substances in their original kind of settings. Now, obviously, you have an interplay of colonial forces with traditional societies and the complexity of after effects from there. But Schultes reminds us that what we're talking about is interactions with plants, with fungi, and that those interactions are mediated not just by your own direct ingestion of these, but by your culture, your belief structure, the way in which the plants are consumed, the expectations and the belief structure, the symbolism involved, what people are told is happening in these situations. So these vary by culture, and I think that's part of the reason we need to understand a little bit more about culture. We know that psychedelics demonstrate what has been called, this is my favorite term in the entire literature on psychedelics, an exquisite sensitivity to context. So as we know, psychedelic experiences are remarkably varied between individuals. We have heightened sensitivity during this, particularly with serotonergic psychedelics, where from a perceptual and cognitive kind of dimension, that you have a real kind of sense both of novelty, of entropy, of uncertainty, but also of heightened awareness. Heightened awareness, perhaps interoceptive, being able to notice your heart rate, sense your breath better, sense more somatic feelings. As we know, there's telltale visuals that happens with psychedelics that occur with eyes closed and with eyes open. So what's happening in the environment, because people are so sensitive in this space, and as we've heard with Deanne, where are you, Deanne? The great sensitivity to these experiences we need to approach with care and with reverence because of what we're asking of people entering into this space. So we need to understand the importance of context, that's set and setting, but even more than that. But also the cultural matrix is the larger setting for psychedelics and psychedelic medicines. So some of the, I've been fortunate to do this work for a while. I taught at University of Ottawa for a while, and we had students come from all over. And we had Maria Mangini, am I getting her name right? Yeah, right? So wonderful woman in the history of psychedelics, particularly if you're interested in the role of women in psychedelics from California. She was a nurse practitioner, if I recall. So she, I don't know how she ended up in one of our classes. Somehow she did, and she's like, well, the one thing that's changed since the 60s to now is the cultural matrix. Our belief structure is different around psychedelics. And I would think if you look at today's society, the level of, I was flying here, the guy beside me was an iron worker heading to BC. We struck up a conversation, it was very common. He's talking about what he does, he asked me what I do. It's always very interesting. But for the most part, as you probably know, people are remarkably interested and remarkably supportive and remarkably sensitive about what the nature of this work is, and really happy to hear it's happening. So this is the kind of thing that in the larger context, I'll call the Michael Pollan effect, which we now have this contagion that everyone thinks that psychedelics will be the next paradigm in psychiatry, the next, approach to mental health. It will be the new. And we know with anything new that there's always a level of enthusiasm, some of which will be borne out, and others might be a bridge too far. So we're trying to find out where that margin is between what psychedelics can actually do and maybe some places that we're asking to do too much. But I think that what we need to recognize is the larger culture right now are the conditions that are creating this work to happen. We're all here because of the changes in culture, the level of popular awareness in this. When I started my PhD in Queens, which was maybe 10, 11 years ago, took me a while, I couldn't find a supervisor. In fact, one of my supervisors is here, Craig Goldie. I wouldn't be here without Craig being willing to suffer through the 7 years of my PhD. Thank you. But I was originally told to go to California because I would not find anyone with any level of interest or skill set to support a PhD on the clinical application of psilocybin. Thankfully, through the good nature of Dr. Goldie and Eric Dumont, who's a cellular neurobiologist, behavioral pharmacologist, who really inculcated in me an understanding of the role of psychedelics in learning and memory. So it's not surprising I ended up in my thesis very much on a learning model of psychedelics. But the culture is important to recognize. Patients are bringing it in to this experience. You're bringing it in, and you're bringing in the culture of your medical profession as well. But culture is simply this interplay of all the beliefs, the expression of practices, symbolism, art. And it's the larger whole, which is, where's Deanne again, the themes of the larger whole, connectivity of the larger whole. I think a lot of the suffering people has to do with separation. Separation from a sense of self, separation from others, separation from culture, from the natural world, from a sense of purpose. And maybe the promise of psychedelics is to help with some of that reconnectivity. But culture is learned, it's shared, and it's the primary way we adapt to our environment. So you notice some themes already. It's the relationship of your inside world to your outside world, the way that's mediated by culture, and it's our adaptability to our environments. And these are things that I think psychedelics help with, because when you listen to patient experiences or hear afterwards, what was your life like after psilocybin? Generally, people report in the literature, and there's some limitations on this, feeling more relational, feeling more open, better relationship with nature, better relationships with family, more interest in the larger world around them. Due to the neurobiological changes, you're more aware at a sensory level as well. You're less in your mind, less rumination. You're taking more sensory information. You're more present. The fear center is kind of suppressed a little bit better of a learner. Mindfulness really key here. And so that plasticity post-session is really, really important. This is where we get into behavioral medicine. Like, what are the practices people need to do after? But there's a period of plasticity. So you can see how context really matters, what you do when, how things fit into the larger whole. And in this case, our larger whole is culture. So I'd originally had this slide. I'm like, going to call it Seeing with Two Eyes. And then I realized I better do some background reading on this. It may not be my own term. And sure enough, it's not. It's an indigenous term called two-eyed seeing. And so I've referenced at least one of the elders who's kind of popularized this notion, and I really appreciate that. But it's the idea, I've always been torn between these dual lineages of psychedelics. Like, I love the ceremonial stuff. I've been fortunate to sit in a lot of ayahuasca ceremonies. I had the great honor of sitting in a Native American church ceremony in Saskatoon that Erica put together with Kelly and Rianne Daniels from the Native American church in Saskatoon. And that was remarkably instructive for me to understand the nature of these rituals and kind of how they work and the benefits they have. But that's the entheogenic history, looks at culture, ceremony, plant medicine, relationship to nature. Then you have the other lineage, which is this Western scientific lineage, for lack of better words. Clinical trials, science, Carhart-Harris, neurobiology, right? I think it's equally beautiful and equally mystical, but it's a bit of a different lineage. So whereas one is anthropological, the other is scientific, one's ethnobotanical, the other is kind of more pharmacological. You have culture versus therapy. We're in the era now of therapy. With 17,000 psychotherapists in Ontario, where's our, yeah. What's the growth been like in the last few years? Just. Thank you. Wow, thank you. I'm so glad you're here. We've got to work a little bit together over the years. So I'm really happy to see you here, Deborah. Thank you. So think about just the rise of therapy and the therapization of normal discourse. I know that's a big deal on TikTok. You know, with young people today, I have 2 teenage daughters. Someone complimented me on my ability to listen, and I said, I have 2 teenage daughters. I know well enough as a girl dad, I don't know anything, just stand back, provide support. But we have an emphasis now on therapy, which is, I contrasted that with the 60s interest in psychedelics, which was about revolution, liberation, social change, reclaiming autonomy, right? That's the historical kind of association with psychedelics. Now it's, I'm going to fix myself. There's something wrong with myself. We have a rise in diagnostic criteria. I reference later the triple crisis in psychiatry, but more and more people being diagnosed with mental health conditions, more and more people on medications. So psychedelics are coming up within that context. And maybe, again, that's countercultural, but it's arriving as a therapeutic context, focusing on a journey. And this is probably where both traditions have overlap, which is a notion of a rite of passage. And I think people in cancer care understand the journey of cancer. And this is a rite of passage to go through something like this. And I'll talk a little bit later about Susan Sontag. The entheogenic history has a lot of interest in ceremonial facilitators, shamanic practices, curanderos, ayahuasqueros, knowledge keeper, medicine men, roadmen. Whereas in more clinical application, we're talking about psychiatrists, we're talking about therapists. Who are the roles? Are they the modern shamans? Are they the modern priests? So you go from, and you can see in Western context how we struggle with this notion of mysticism. In non-ordinary states of consciousness, there's debates in the field about how you define mysticism. The questionnaires we use to do the mystical experiences questionnaire after these are quite problematic. The language alone is very odd, and trying to do it with someone post-psilocybin is equally more confusing and interesting. But some of how we define mysticism is somewhat questionable, and we're also not greatly skilled in it. Generally, we're not raised to have skills in altering our consciousness. Most of us as kids did those things where you hold your breath till you pass out. Maybe there's just those of us on army bases, but we're always doing silly things like that as children. You play with consciousness in a way. But as adults, we know there's stigma around drug use. We know there's stigma around alterations of consciousness. Some of the things you could say in a psychedelic state, people could perceive as psychotic. So we have these kind of cultural translations we're trying to make through all this. So I want to kind of see with two eyes. People are familiar with drug set and settings. This is the key concept in understanding psychedelic psychopharmacology. I want to broaden it a little farther. Are people familiar with the work of Kevin Feeney? Okay, so he's written mostly about peyote. So he has something called the total drug effect, which he's taken drug set and setting and added two other factors. So it's important, and Leah, you can talk to this better than anyone, but how drug effect is constructed is not strictly mechanistic. The variation in psilocybin experiences alone will tell you that, just how widely varied they are. But it could be varied, it could be influenced by time of day. It definitely is influenced by the psychological content you're bringing, which could be varied over time and at different stages of your life. We know within the clinical trial literature, the best outcomes were among people who are older. People at my age in their 50s, and in our alcohol use trial, most people often were mid-50s, and almost like a crisis of coming into the stage in our lives. Our kids are growing, you've had your professional identity kind of established, and then you're like, what now? What is my legacy? You start to think a little bit bigger. But we know that psychedelics, as much as they're consumed by younger people, there's something about later in life that seems to really help with meaning making. And you can see why we started to think about, and it's always evolved in the context of possibly related to death practices as well. So drug obviously is part of it, so we need to understand. And I would argue in psychedelics, we do not spend enough time on psychopharmacology. You are interacting with something that has a material basis. It's interacting with I know we get to consciousness, psychological phenomena, and emotional phenomena. It's very important in our skills, but it has a biological basis. So what part of the brain is it interacting with? What are the downstream effects? Set is important, and that's not just kind of the person and their mindset, but their attributes, their history, their expectations, and their beliefs around psychedelics. And as we know, with the pollen effect or the contagion effect, we have a lot of patients coming in because they've heard psychedelics are going to help them see God, have a mystical experience, overcome their trauma, heal. That's a heck of an expectation for a little mushroom. There's reason to think that, but we need to understand also that these are kinds of experiences where you're not just giving someone a medication and it has an effect, but as Dan indicated, the skills of the participant are really important. They meet the medicine, they interact with it, and their knowledge and sense of beliefs or confidence in the space is really, really important. Most people in my experience who want to undertake this want the trust of knowing that they're safe. The people around them know what they're doing, the setting is safe. Because for a lot of people, these are very scary experiences, or can be. So you have all these interactions. Their belief about you or the modality is super important. So if someone comes into the room and they meet you and they're, oh, seems really important. He seems like he knows what he's doing. He's got a lot of letters behind his name. He's running a clinical trial. This is legitimate science. And it really does help people. That's part of the reason clinical trial participants, the Olympians of cancer, tend to probably do better than people in more naturalistic settings, because you've had exclusion and inclusion criteria that kind of refine the outcomes, but the attributes they have, but also their belief in you really matters, and their belief in the modality. So I'm always interested in our informed consent. What are we telling people about psilocybin? What are we telling people about DMT? What are we telling them about the experience they're going to have? Do we tell them what it is? There's an ethical responsibility. What kind of level of minimal psychological preparation do we do without kind of determining the outcomes as a therapist, when to intervene and when you don't? It's that whole dance of all these variables. But their beliefs about you and the modality are really, really important, which is why in our promotional literature, it's important. Are we introducing expectancy if we're going to advertise a clinical trial? And there's some different ways to reduce that. The immediate setting is really important. It needs to be cultivated for the sensitivity of a serotonergic psychedelic, which we know people have increased sensitivity to light, to sound, to color, all sorts of visual changes happening, an emotional opening happening, a fear happens, people can get quite anxious. So we need to make sure they're in a safe environment. Windows can't open that they can jump out of, is the old kind of cliche. But also that, the music, the role of the music. Deanne, you were really articulate about talking about the importance of music, and that's part of that immediate setting. And then there's a larger cultural context, which has, I think, been largely kind of minimized in our understanding. We tend to look at the more clinical variables, but you can see by this model, therapeutic effects are the interaction of all of these. And in the context when he examined Native American church and peyote use, it was medicinal not just because of the mescaline, which tends to be our bias. It's the drug has the power. The drug has this kind of these kind of known therapeutic applications. but because it's embedded in ritual, community, ethics, and culture. So in terms of contemporary culture, this is probably the most significant scientific image, I would argue, that has been presented maybe in the last 30 years, 20 years. It's 2014. Anyone know what this is? Anyone want to volunteer? Your brain, which one's your brain on psilocybin? Clearly. Does anyone know where this is from or what year? I said 2014. So most people probably know of it through the Michael Pollan book, I'd imagine. Michael Pollan used this. Carhart Harris uses it in his, I think, his 2016 publication. It's a 2014 publication, McPetrie. This is placebo on one side, psilocybin on the other, fMRI data. Your brain doesn't actually look like that. If people have done fMRIs, you know the difference between kind of noise and signal. There's a lot of interpretation in these things. But here you have the evolution of the most dominant, I would argue, paradigm scientifically for understanding psychedelics, which is Carhart Harris. I'm not arguing. I think it's brilliant. I think it's mostly right. But we have to understand this was a, does anyone know what Carhart Harris's master's was in? Freudian psychology. Yeah, he learned neuroscience under David Nutt in his PhD, and obviously went on to do just, and continues to do incredible work, but he was a Freudian. The importance of the unconscious. So when they're interpreting and develop these models, we now, everybody thinks this is scientific truth, which I think we can argue, there's a reason to say this is evidence-based. So what this is capturing, for those who don't know, is in the placebo, if we're here for a trial around anxiety or depression, we tend to ruminate. Our thinking becomes, same with addiction, our thinking and behavior become more narrow in scope, not as wide variety. So we tend to think about the same repetitive patterns of self-judgment, whatever it is. Depression is self-judgment, despair. And so you have this activation of your prefrontal cortex. And so you really have a lot of rumination. With the introduction of psychedelic, you have this serotonergically cued desynchronization, not only of like brainwave oscillations, but of connectivity patterns in your brain that persist actively and acutely during the period of drug effect, which is psilocybin, we're going to say 8 hours. And then after that, there's downstream secondary effects, and then I would argue longer term persisting effects neurobiologically. And Fred Barrett has documented what, up to 30 days, you have very clear neurobiological evidence of improved global connectivity patterns. So people are now all interested in neuroscience, neuroplasticity. Every TikTok influencer and Instagram plant medicine advocate is talking about plastic, which is brilliant. I really, really love this. I think it's really important. If people listen to Andrew Huberman, thank you for your interest in science. Look at the overlap of Huberman, that interest in science, and psychedelics. And I'd say that's there as well, right? So you have this renaissance in interest in psychedelics around neuroplasticity, I think because of this, which is all good, but it's introducing certain biases. Here we are, back to the 60s. This is where it all began. This is where it all began. And we need to understand our own humble origins and our humble roots. We would probably not be here without the counterculture and the social changes it brought, the openness towards psychedelics, the openness towards drug states, which by then have been, obviously there's a huge with the war on drugs was soon after this, maybe as a response to overdoing it on LSD. But we understand the politics around drug legalization, drug prohibition are not grounded in evidence and science. They are generally ideological in nature. So this was a huge holdup for us in terms of doing the research for many, many decades. But when you go back to the 60s, psychedelics were really, really important. It was hugely part of the countercultural identification. It created experiences of bonding. Sometimes these are called kindelics. They bring people together. That is part of the historical cultural application of things like ayahuasca ceremonies. Young individuals in Amazonian indigenous communities wouldn't do ayahuasca ceremonies the night before a hunt in order to deal with their mental anguish. They would do ayahuasca ceremonies the night before a hunt to better understand, to better listen, to better see. And so people remember the story. I don't know if you saw the documentary. There were like 4 kids in a plane crash who got lost in the Amazonian bases a couple years ago. You know the story. It took weeks to find them. There's like 4 of them. You know how they eventually found? It was an Amazonian ayahuasquero. Himself did ayahuasca dosage, went out the next day. And it's just, what happens is afterwards, your acuity, your visual acuity is better. You see better after. You notice more detail, in part because you're more place-based, you're more present. but also your senses are increased. Your sensory motor connectivity is increased. So they were able to go out and be better hunters because they could see and hear better. And they would understand better the movements of nature because they're not in their head. So, but it was also a way to bring in young people into the enculturation of their societies. What was the cosmology of that community? And in the same way, at least the 60s had this element of a common or shared cosmology being developed. The other thing culturally I want to recognize is the importance of the underground. We have had a very vibrant and active underground in psychedelic-assisted therapy in North America for now 50 years, if not longer. And many of the people who were originally involved in the 1960s helped to form the model we all still now rely on, which is the peak psychedelic model, right? You want to get people to this almost like overwhelming, unbelievably charged state of possibility and entropy. And it wasn't about, originally there was like talk therapy involved, but then it went to this model where you're just kind of getting people to have this direct internal experience. And for many, like Salvador Roquette, they wanted this experience to be overwhelming because you're breaking down people's defenses. So Roquette would not only give people LSD, but display videos of pornography, of violence, because it was not my style. I have problems with that, but it shows you culturally that this belief structure early on in the origins of psychedelic therapy was to overwhelm people. I don't think that's something we want to continue. I think that's one of the more problematic elements. You see that still today in underground ayahuasca ceremonies in Canada. Deal with a lot of people who come away from ceremonies very disaggregated, very destabilized. So part of it is how do you provide support? But we have not only a vast underground in Canada, but it's been around a long time. And I'd say on any given weekend, we probably have hundreds of ayahuasca ceremonies in Canada on any given weekend, easily. And so this is something people are going through, and many people are having great experiences, very, very beneficial experiences. Who are the people doing these? They're often therapists, clinicians, other people doing it in a way because they see a usefulness to it. But it's happening in a way that's kind of evolved in itself without a lot of community of practice, if that makes sense. People are kind of doing their individual thing based on their lineages. And I think that's why these kinds of gatherings are so important, because we can build more consensus and we can get out of our own practice models and hear from others. But the original kind of, and I think there was probably one before this, but in '62, one of the first manuals for psychedelic-assisted therapy was developed by Larry. I think they bought a hotel in Mexico, if I recall correct. And you were down there and lived and did a whole lot of psilocybin and LSD with Larry, and you studied the Book of the Dead. And the whole model of understanding the psychedelic drug effect was a journey into death and back, ego dissolution. Is that true in all cultural indigenous histories that really wasn't often the case? Often they were coming together, they were learning experiences, but this notion that they can be really difficult, that you're confronting denial, you're overwhelming yourself to kind of break through, is a very Western concept. So the contemporary landscape, what's kind of informing CAN-PACT as we're all working and coming together for these next few days to develop all this, is you have the scientific and clinical research and the implicit belief structure of modern medicine, that medications have an effect, that as therapists we can have effect. So these are belief structures. You have a role of advocacy groups, nonprofits, but also bona fide religious organizations like the Santo Daime, who've been legal in Canada for a long time and have multiple chapters. I think there's 7 legal ayahuasca churches in Canada now. You have a very active Native American church in Saskatchewan and BC primarily. That is a legal entheogenic ceremony with a very lengthy, almost unchanged history of practice with living lineages. You have a whole rise of the spiritual but not religious movement, an increase in interest in mindfulness, breath work, right? That's kind of coming out of often the yoga communities. You have the rise, and I heard Dr. Human, I heard you talking about this, the importance of somatic therapies. This is really important. More and more people are finding relief and benefit from becoming more connected to their body, not less. And that often in our heads, in rumination, we lose a sense of presence. Sometimes there's sensory pathways to healing trauma, to quote Ruth Lanius, who's out of Western, who has a new book called exactly that. So the whole idea that by awareness of your body and your context, you can heal, is very similar to me to land-based healing, or because it's place-based, much like learning and memory is place-based. So the 3 C's of psychedelics, in my opinion, a couple closing slides here. I think we're building capacity, personally, professionally, skills, but also for our patients and participants. Capacity is really important. These are often overwhelming, non-ordinary states. We need to practice them with people beforehand. It's a skilled experience. It's not a medication we're giving, and it just has a mechanistic effect. It's where the person meets it, and it's how they meet it, the skill, the personal influences they bring in, how you meet it. So we need to prepare people to be active participants in this. It's really, really important. Context is important to time and space, patient selection. It's not always a great time for people with advanced cancer to do psychedelics. I've worked with a lot of people who say, my life's psychedelic enough right now. I couldn't imagine doing this. It'd be too destabilizing. So patient selection, timing, the right person's really important. Attention to time and space, but also to understand that your interactions and our interactions with people also have a ritualistic dimension. That these kind of practices, when you bring someone into a dosing session, are really important. What the room is like, how you meet them. I think when you and I originally talked, you talked about the bell ringing at the end of cancer therapies and how that doesn't happen for some people. I feel like we need one of those for the ends of psychedelics. There needs to be some symbolic. I noticed the gong. That's how I knew we were in the right place. There's a gong. But like, I know traditionally it might have been flowers, but something at the end of these sessions to acknowledge the courage and the achievement of people. These are journeys. These are really heroic journeys into self, into other, into meaning. So we need somehow to recognize the importance of context and connectivity. As we know, neurobiologically, it's all about increased connectivity, more global connectivity. And that's kind of in a way, when people talk about being more relational afterwards, they're feeling more connected. Usually I say to people, like when you go into psilocybin in particular, you need to be ready because everything needs to be welcome. If you think you're going to suppress something or avoid it or outthink it, the mushroom is way smarter than you. You learn to just, and you need to accept. That's where the letting go comes from. But it's this notion where everything is welcome. And you need to prepare people for what comes up. And that's some skills of self-regulation, acceptance, knowledge. And there's, as you said, these persisting changes. So I think this is, psychosocial oncology is a perfect place to develop these kind of models of psychedelic therapy in Canada, in my opinion. It's already got a groundwork in this. It's an open, sweet, sensitive space already. I look at the people here today and the incredible work you do. I'm just so grateful we're here right now. So it's a very tender space to do the work, which I really, really like. There's a whole history of, if people, I won't get into Sontag, but if you haven't read Illness as Metaphor, you know, the kind of symbolic experience of going through illness. It's very difficult for people, particularly when it's chronic and long going and demoralization. At the end of the day, therapy and ceremony is about encouraging people, bringing people together and encouraging people in their life. The origins of psychotherapy were around encouraging people. So I think we go back to that, but we have to recognize the role of rituals in this. And I'm just going to close with this. I love this concept of doctrine of signatures. This is just my plea to make sure whatever we do, it works at multiple levels, is consistent with the biological effect, it's consistent with the known psychological effect, and have a model that kind of is consistent through it all. I would say that in psychedelics, this is still a community of inquiry. We're learning. No one's got all the answers, but we've learned a lot. But for me, we know what's the role of mushrooms in nature? Mycelial networks, hyphae, these strands that go out and connect, right? It's all underground. You don't see it. You just see this fruiting body of the mushroom comes up, which is really just the product of the sexual union. But there's this vast underground network, which we all carry, the network to our ancestors, our aunts, our parents, our friends, all the people who helped us get where we are. We all carry these networks with us, but we just see ourselves. We're the little mushrooms, but we have these networks. It's rooted in a biological mechanism. It is this global connectivity. It's the suppression of the default mode network. It's the changes that happen both acute and in a persisting way. So let's make sure we're rooted in biology here. I think these are plant-based medicines. We need to understand the physical nature of the basis of this. The therapeutic mechanisms, we know it's reductions in fear, disruption of habit. People tend to have better relationality afterwards, more cognitive flexibility. People are better learners after. I never considered myself a behavioralist till I got to the end of my PhD. I'm like, oh my God, I'm a freaking behavioralist, because what you do after psychedelics is really important to conditioning the therapeutic outcomes. It's just the way long-term potentiation works. Read my thesis if you want to know more. And then just the example, again, I'm just going to close on one thing, which is if people know psilocybin and you know the visuals, it has two very telltale visual effects. One is if you think of Alice in Wonderland, the mushroom that gets bigger and smaller. When you take mushrooms, it contracts nearby visual space. So you're close to me, you look even bigger. Farther away, you look even farther. What does that tell me? The things that are important to my life appear bigger under psilocybin. And then edge definition really eludes as well. So you don't have clear contrast between things in your perception, like depth or fine lines. It all kind of becomes one system. So connectivity again, right? So that's what I mean by like a doctrine of signatures. The biological effect and the therapeutic effect are very similar. They all have to do with connectivity. I think that's it. In closing, thank you for your involvement. The burning, it's just beginning all this, and I really look forward to the next few days.
Wow, unbelievable, Ron. Thank you. You can see Ron has incredible, not only breadth of knowledge, but depth of knowledge and personal experience. And we're just so happy that you're a part of this endeavor. We're so fortunate to learn from you.